Thank you so much for choosing Dr. Chandler and the rest of the OMS of Utah team for your oral surgery needs. My name is Micah, and I'm going to be going over some postoperative instructions for implants and or bone grafting. All of our implant patients will be sent home with a pamphlet that looks just like this. It has all of the information that you need to know. The biggest, most important thing that we want our patients to be aware of is that we do have a doctor on call nights and weekends, so there's always somebody that can help you if you need anything. Our office phone number can be found at the top of that sheet, so feel free to call even if it is after hours. We're here for you. First, let's talk about the prescription medications you'll be sent home with and pain control. Typically for these procedures, Dr. Chandler will be prescribing ibuprofen 600. We ask that you use that in addition to over-the-counter Tylenol at home for your main pain control. If that's not quite keeping you comfortable, we'll also include a prescription for Ultram, which is an opioid and can be added to your ibuprofen and Tylenol for maximum pain control. Dr. Chandler will be prescribing the patient with an antibiotic following an implant or bone grafting procedure. This is just to ensure that no infection pops up around that surgical area as it heals. Please be sure to get your antibiotic prescription filled and begin taking it as soon as you can after surgery. It's important that you read the directions on the container and take that prescription until it's completely gone. Keep in mind that the peak of pain and swelling will likely be the 3rd or 4th day of recovery. If for any reason these prescriptions are different than what I've gone over, Dr. Chandler will go over those with you after the procedure is over. Keep in mind that a little bit of bleeding following this type of surgery is normal and to be expected. We will send the patient home with some gauze that they can use to gently place over the surgical area to help absorb any bleeding. Biggest questions that follow a implant surgery is how to manage your oral hygiene. We want our patients to know that we encourage them to brush and floss all of their other teeth normally, but just be gentle and avoid the surgical area until your follow-up appointment with us. It is highly likely that Dr. Chandler will also prescribe an antibacterial mouth rinse. We want our patients to begin using that the day after surgery to help keep things healthy and clean as they heal. Light rinsing morning and night should be sufficient. Patients often have a lot of questions on what they can eat following an implant procedure. We want our patients to stick to cool, soft foods for the first 24 hours. After that initial 24 hours, the patient may move on to warmer foods, things they're feeling up to chewing. That being said, we do not want any pressure or chewing on the implant whatsoever. So we would recommend that you stick to softer foods for at least a few weeks following surgery. That way you don't accidentally bite something hard on your newly placed implant. Let's discuss bone grafting. Anytime an implant is placed, there's a high probability that some type of bone grafting will have to be done around that implant. If the patient did get bone grafting today, Dr. Chandler will let you know. Please keep in mind that that bone is almost like a sand-like consistency, and little parts and pieces of that may kind of fall out as the patient heals. Please know that this is normal and nothing to worry about. Your dental implant is placed, you're probably wondering what's next. Typically, what the future will look like for you is at the 2-week mark from your surgery, Dr. Chandler will see the patient back in the office for a follow-up procedure that's really quick and easy, just to make sure that things are looking healthy and healing the way they're supposed to. As long as that appointment goes well, we'll then schedule you for your stability test. At that time, we test the implant, make sure that it's nice and firm, and then you'll be able to get your crown from your general dentist. If you haven't already scheduled your 2-week postoperative appointment, please be sure to do that before you leave our office. Thank you so much for choosing Dr. Chandler and the OMS of Utah team for your implant needs. We're really excited for you. Also, always remember you can call our office anytime with any concerns or questions.